Okay. So this is the letter that we were discussing over here. See, I'm just
Hmm.
showing you the picture because I have to, because you already have got the basic idea. Now I just have to tell you how to write it down. So if you see, it is written Dr. Lisa Smith, and
Yeah.
that is given in your purpose. Okay. Endocrinologist, that's the profession of the doctor, working in at City Hospital and living, which is at in Newtown. Okay, so this is the basic layout that you have to follow. Always, whatever the letter is, you just have to mention, and you have just have to follow this, basic structure. Okay, so just have to follow this particular basic structure. Okay, now
Hmm.
then you have to write the date, whatever the date is mentioned inside the letter. Just follow that, and then dear doctor. So now there are two methods of writing this thing. Okay, the first one is you can just mention the way I have written, dear doctor, or the second one is you can mention the name of the doctor like this, dear doctor, and the second name Smith. Both are fine, whatever you feel okay with, you can go with it. Okay, no problem. Am I clear so
I
far?
mentioned respected Dr. Smith. Is it fine?
No, that's not okay. You just have to write dear Dr. Smith. There is no respected in England, in here in
Okay.
NHS. We are working. We do not show our respect to our colleagues or the seniors or the juniors this way by telling them that you're respected to us, or we respect you. Okay.
Sure.
Yeah. So we don't. That's happening in over there in Pakistan, not here. So we have to be
Yeah.
very clear. Okay. You have to write dear doctor, not respected, and okay, not the things that we do in Pakistan. Okay, so dear doctor, okay, dear doctor or dear Doctor Smith. Always write the second name. These people from Australia or England or anywhere, okay, these Goras, they really like the second name. They don't want you to call the first name
Hmm.
until you are their study buddy. Okay, so always
Yeah.
write the second name. Okay, so dear Doctor Smith. That's the first thing. Now, then comes so see, this is the standard structure that you're going to write in every letter. Whatever the letter you write, you just have to mention this thing. Now, after that, you have to write RE, okay. Then you have to write the name of the patient, Mrs. Priya Sharma. Always write the full name of the patient over here when you're mentioning the basic information of the patient, okay, and the age. Now, this particular area of the age or date of birth, it has a lot of different varieties to write, and whatever you write, I can assure you that you write correct. Okay, you are correct on it. Okay, but
Hmm.
always remember that you have to write the name of the patient. The picture that you sent me, okay, there is no name
Yeah.
of the patient mentioned. Okay, but if you won't mention this way,
Yeah.
then there is a problem. Okay, you will lose your score, and that's the basic thing. Now, if you are losing even a point from here, from this part, you are already gone. Okay, because this is the basic structure. If you don't know the structure, the basic thing in the OET writing, they will not pass you, even though your writing will be absolutely tremendous. Okay, they will not let you pass. Am I clear so far? Hello.
Yes, yes, I got it.
Okay. Now further. Now this is your purpose. The purpose starts from here. Let me remove this one.
Hmm.
Okay, so the purpose starts from here, and your purpose should be very concise and accurate.
Yeah.
See, there is a criteria. If you go open the official OET, and the writing criteria, you will they have this massive page in which everything is written, that how many scores from which part of the writing you need to pass. Okay, purpose is the most important thing over here, because you need at least 3 points out of 7 to pass in OET. Okay, if your
We have
everything is
to
correct.
write a single letter?
Sorry.
Do we have to write a single letter in OET exam?
Yeah, there is going to be a one letter.
Okay.
See, there are 4 parts of the exam: reading
Yeah,
1,
yeah.
listening, writing, and speaking. And only in speaking you will have 2 cards. There is one letter
2
only.
role plays. Yeah.
Okay. Yeah. So you have to write, and that can be of any type. I mentioned the types in the lecture that I sent you. Okay.
Yeah.
Now this is your purpose. Okay, this is your purpose. Always remember, I mentioned in the lecture as well. There should be 2 things in the purpose. Can you recall those for me?
I didn't understand. What did you say?
I said there are 2 things in the purpose. Can you recall those things for me? Do you know what are those that I mentioned in the lecture that I sent you?
Urgent and a normal referral, I guess.
No, it's not about that. I'm asking specifically about the purpose. What 2 things should be there in the purpose?
I'll have to
Always,
mention about the patient's condition and what I want from doctor,
yes.
right?
So you need the reason, if I
Hmm.
would be uh, more correct. So you need a reason. Why are you referring the patient? A reason for referral, a reason for discharge, reason for transfer, reason for urgent referral, a reason for updates. What is the condition? Why you are sending the patient to someone else? The reason behind it, and what you are looking for. What are your demands from the person? For example, you are a GP, I am a consultant. Okay, you are sending a patient to me. Okay, for example, here there's a Dr. Lisa. I am Dr. Smith. You are, say, you are Dr. Yusra. Okay. So Dr. Yusra is sending her patient to Dr. Smith. You are a GP. I'm a consultant. So why you are sending the patient? There should be a reason, right? You can't just, if the
Yeah.
patient comes in, you can't say, okay, go to Dr. Smith. I'm not going to see you. Obviously, you're a GP, it's your duty. You will sit down, you'll check the patient, you'll try to understand the history. Once you have done with the history, then you'll understand this is not my case. Let me refer you to the further doctor. Okay, that's the process. So the reason is important here. If you see the case notes, what is the reason? The Mrs. Smith, Mrs. Sharma, she's coming up with the uncontrolled blood sugar levels on many different occasions, and currently as well, her blood sugar levels, the random are 7 to 8. Okay, and the fastings are also high. So the consistent high blood sugar levels are the reason you're sending the patient to Dr. Smith, who is an endocrinologist. Okay, and what you
Yeah.
need from Dr. Smith, you need further assessment and management. Okay,
Yeah.
because you try to manage the patient, you try to help the patient by making our sugar levels down, but you were not successful, and that's why you're sending the patient, right? So what you need
Hmm.
further assessment and management of this patient. So that is your purpose. So if I am you, or if you
Purpose.
have to write the purpose, so how would you write it this way? I'm writing refer. This is the type. Okay, I'm writing to refer Mrs. Sharma. I'm writing to refer Mrs. Sharma, who has uncontrolled type 2 diabetes, or who has uncontrolled sugar levels, or who has uncontrolled DM. Whatever you want to mention, everything is fine over here. Okay. Who has uncontrolled type 2 diabetes, your further assessment and management would be highly appreciated. So by looking at the purpose, it is clearly mentioned. If even someone is blind, he or she will understand the core concept, or the core, I would say, the crux of the letter in these two lines. Am I right about it?
Hmm. Yeah.
Yeah. You have to
Yeah.
write the purpose this way. Okay. Then you'll get 6 out of 7 minimum if you write this way. Okay. So
Yeah.
this is how you're going to write the purpose. Now let's come down to the body of the letter. Okay. Now the further letter is, you have, there are, if you see over here in the case notes, okay, if you see over here in the case notes, that is the purpose. Now comes the visit. Okay, and when I say visit, so you see this is the first visit on 29th of December 2018. Patient presented to you the first time, and what were the complaints at that particular time? She was concerned that her glucose levels were not well enough controlled. So now you just have to use the information that is given inside the case notes to write your letter. Are you following me?
Yeah.
Yeah, you're getting my point. See, you just have to. So, for example, you have to write the this visit. Okay. So, how would you start? So, you will write on 29th of December 2018, Mrs. Sharma, okay, presented with concerns regarding her uncontrolled sugar levels. Okay, so is it the right thing that is mentioned over here in this line?
Yeah.
She attended the health center and felt that her concerns were not taken seriously as her blood sugar levels were 6 to 8. So now I am just making a sentence out of the information because I'm
Is
writing in
it
the past.
necessary? Is it necessary to mention that she attended a healthcare and no one was taking her seriously?
Yes, 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 it is important. Why it's important? Because the patient has mentioned in the discussion. She
Okay.
specifically pointed out, if, and that's important information. In here in NHS, we don't take, these things for granted. If a GP or a health center is not attending the patient efficiently, patients can go and complain. In hospitals, there is a vast complaint system called PALS. Okay, so these patients do go there. Even if I have seen the patient and the patient is not happy with me, they can go to my senior, but it is my duty to tell them how to complain about me. Okay, that's how the system works over here.
Got
You
it.
following me? Yeah.
Yeah, yeah,
So
I got it.
it's important. Yeah, so it's important. So you have to mention these things. Okay, so again, she attend, because I'm writing in the past, so you have to write the past sentence, okay, or the past tense. So you will just convert the attends into attended, health center, feels into felt, okay, that her concerns were not taken seriously, taking into taken. You just
Yeah.
completing the sentence into and you're converting the present into the past. Okay. As her blood sugar levels were 6 to 18. Okay, then this information, no need to write. Last I checked, nothing is important. Weight is important. You will mention the weight in the examination, appetite good, good diet, bowels normal, you can skip it. So these two lines are important along with this BMI. Okay. Now
Yeah.
move further. Let's move further. Now you will write next on examination. See, everything is normal. Okay, everything is normal. Physical exam, NAD, it means no findings. BP was important, it is mentioned 155/100. No peripheral neuropathy, pelvic exam was not performed, pathologies were requested, everything is normal. Okay, and some relevant investigations are ordered, and you prescribed candesartan tablet 4 mg. Okay, and you ask the patient to come after 2 weeks. Okay, how would you write this one? So on exam, her general physical examination was unremarkable. Okay, except blood pressure of 155/100. Okay, therefore some relevant investigations were ordered. Okay, and tablet candesartan 4 mg was added. Okay, she was asked to review after 2 weeks, or even if you want, you can skip it up. Am I clear?
Yeah, yeah.
Okay, now if we go down and if we see the picture that I have shown you already, see over here it is written on this date Mrs. Sharma was concerned about her uncontrolled glucose level and she felt ignored, or she was not, you can mention this way as well, and the way I told you, both are fine. Similar thing by medical staff, as her blood sugar level was 6 to 18. Okay, her examination was unremarkable except blood pressure of 155/100, or was 155/100. She was commenced on candesartan for hypertension, and some relevant tests were ordered. Okay, simple.
I
You
have a
just
question,
have,
doctor.
yeah.
Like they are mentioning the BSL was 6 to 18. I cannot get it as we in daily routine here we consider 126 or 200 mg per DL. Is it a
Okay,
different unit?
yeah. So see, in NHS we use different units. Okay, 6 to 18 is a different unit system, not in the way in the Pakistan. So if you calculate, it would become about that. Okay, so they are taking in
Okay.
millimole. Basically G per deciliter. Hey, can you hear me, doctor?
Yeah, I can.
Okay, so the units are basically different. Okay, in
Okay.
Pakistan we use mg per deciliter, if I'm not wrong. Over here it's like millimole, so both are similar things, no problem. Okay, it's just
Okay.
the units factor. Okay, and do not start converting it down over from mg to millimole. It's not your duty. It's not a medical exam. It's just simple English language exam. You have to follow the English language style. Okay, so however, this is how you're going to write it down. Okay, I'm just giving you, see, you were unable to complete your letter, so I'm just explaining you how to write it down. So now whatever I've explained to you, you just have to use this formula to write a letter. Okay, and it's okay to make mistakes. I mean, That's why I'm here. I will be telling you how to write it down, when, what, how. I will be explaining each and everything, every part to you. Okay. And it is going to be an individual class between you and I. So no one is going to see your mistakes until I upload it on YouTube. Okay. So, and I won't do that. Okay. I will private it, and later on, if you'll permit it, then we'll upload it. But for the study purpose. But you can make mistakes, and I can evaluate your letter on daily basis this way.
Yeah.
Okay. Yeah. So
Yeah. Yeah.
now I'm not going to go further, because if I'll go further, this letter will be gone for you. You will understand how to write it down, and then you won't understand. So whatever I explained to you, this is how you're going to write every purpose. Oh, sorry, every paragraph. Okay. Now this is the second visit, then the third visit, then the fourth visit, and the fifth, sixth visits. Okay. Now I'm just going to give you a little idea about the remaining visits. Just remember this visit and this visit. You can skip it. Okay, do not write it down, because there is no much information over here. Home BP is in range, pathology requested, pathology report received, everything is normal. So you can skip this one. Okay, but mention this visit, and this is the most important visit because it's a today's visit. Okay, today's visit is the most important. Why? Because this is the visit on which you are deciding whether you are referring the patient or not. So you have to write it down separately. Okay, you are not going to merge
Yeah.
it into any other visit. Okay, so if you see over here, I have merged remaining visits over here. Okay, and the today's visit, it's a separate, even if in a 1.5 line. Okay,
Yeah.
Mrs. Sharma, today, Mrs. And mention, don't write date in today's visit. Mention it's today. This word today is important. Don't write date the way you're writing in the previous visits. Okay, and then you have to write the history that I mentioned in the basic lecture as well, and the conclusion, and then you're done and dusted. Okay, so you're okay to make mistakes. You are completely permitted. No one is gonna judge you on the basis of that, and no one is going to put any bad remarks on it. So you have a complete liberty of making mistakes. Just one request that I have to make: always remember, make a mistake, and once that mistake is evaluated and explained, do not make that particular mistake again. That is your duty. Rest is on me. I will
Yeah.
explain everything to you on daily basis.
I'll
Yeah,
try my
because if
best.
you'll keep on, ma- that's completely understandable. Okay, and you have take the exam. So inshallah, Allah Pak will help you out, and you will be on the other side as well one day, inshallah. So,
Inshallah.
but just remember, if you're stuck somewhere, just send me a text
Yeah.
message. I might not respond very quickly to you. Okay, just bear with me for
Yeah.
that.
Yeah.
Maybe I'll
I
take
got
some
it. You
time.
must be so busy.
Okay, yeah. But I can assure you that whenever I'll see your message, I'll respond to you. Okay, so whenever you are stuck
Yeah.
somewhere, you can send me a voice note, you can write a text message whenever you see, and definitely for the writing, you have to write this particular letter again. Okay, send it to me tomorrow. I will
Yes.
evaluate it. I will send you a voice note back, or if your letter is, God forbid, very poorly written, we might have another class. Okay, until your letters are not good, we will be having classes. Once your letters are done, we will
Yeah.
just have two. And believe me, once you'll start writing it, and once you're in flow, it will take 2 3 letters at start. But once you're past 5 letters, okay, then everything will be in line. You will understand how to write, what not to include, what to include. Everything will be clear after 4 5 letters. So give yourself some time for 4 or 5 letters, okay? And don't panic and don't worry that your letters are very bad, because at start you're going to get very bad score, and that's important to get that way. Because if I'll not give you a bad score, you will not improve. Okay. But once your letters are
Sure.
fine, then it's going to be a 1 or 2 minute conversation maximum. Okay, I will see your letter, I'll grade it, and we'll move further. Okay. So just write 2 or 3 letters, and then we'll talk about the speaking. Okay. By then, just take some information. I am going to send you a few of the recorded videos regarding the reading and listening part. Whenever you have time, go through that, and I am going to send you the link of the YouTube channel as well. I'm not very much active these days, but there's a whole playlist of the reading, listening, writing, and speaking of
Yeah,
different
I
people's
watched
home.
your
Yeah, that's good. So
channel.
just keep on watching those videos of different letters. So, and you will understand that everybody has a different way of writing. You will see that none of the letter is similar. Okay, even though the case notes are similar for every letter, but everybody has written it in a different way. So you can watch 4, 5, 10 videos. You can develop your own writing style out of it, and then you can start writing. Okay, and that's why we have uploaded those videos over there as
Sure.
well. Yeah. If you have any question, anytime,
Yeah.
anywhere, you can send me a text message. I'll be there whenever possible. If you have any question, I'm here to answer.
I'm all clear right now, I guess, for now.
Okay. Okay, that's great. Whenever you feel there is any question, you know what to do. Just a quick clarification. Why are you taking OET at the first instance? Okay, so let me just uh, stop the recording. That should be off.